Hello everyone, and welcome to Beyond 11%. I'm Dr. Adam Seay. Many of you probably have seen a chiropractor in the past. Many of you may never have stepped foot in a chiropractor's office. Well, with this video, I'm hoping to enlighten you as to what chiropractic really is about. See, the general public perceives chiropractic as back and neck pain relief. But what I want to tell you is chiropractic is so much more than that. Chiropractic is wellness care. And we'll explain more about this and how you, your family, and everybody on the planet will benefit from chiropractic care. To give you a little bit of background about myself, I'm a board-certified chiropractic physician, been in private practice since 2005 in North Carolina, and my practice focuses on applied kinesiology, on functional neurology, and on functional medicine. In this video, again, I will explain the benefit of the chiropractic adjustment. Most people understand the importance of dental checkups to prevent cavities, but very few people actually go to their chiropractor regularly for checkups. And you can live without your teeth, but you cannot live without your nervous system, and we'll explain chiropractic's tie into the nervous system. Again, chiropractors only see 11% of the population. This is mainly because chiropractic is viewed as treatment for back and neck pain only. My goal is to educate people as to why chiropractic is vital to their health and to take chiropractic beyond the 11%. Hippocrates is noted for saying, "Look well to the spine for the cause of disease," and he was right. Our current model that we have in healthcare right now is a sickness care model. Most people are down here at disease or sickness, or they're ill, they have some type of issue. This is usually what motivates people to go see a physician. Probably go to their primary care or medical doctor. And what they do, allopathic medicine works very well here. They take you from a disease state to a decrease in function, and then that's where they end, because they work down here in sickness care. Well, you can see it doesn't take much if you're at a decrease in function to drop back down to sickness and disease. So what we want to do in chiropractic is actually take you beyond that. We want to take you beyond the decrease in function up here to optimal health. When you're up here to optimal health, you can see how far it takes, or how long it takes, to get you back to a sickness and disease state. So again, the only way you're going to go from a decrease in function up to optimal health is we have to address the nervous system. And we're the only profession that's doing this. Nobody else is doing that. Everybody else is putting you right back here to a decrease in function. So let me explain how we do this. Your brain controls every aspect of your bodily functions. It does your heartbeat, your digestion, your immune system, your endocrine system, your respiration. Everything is controlled by the nervous system. Your brain must have fuel and activation to function. It can't live without those two things. Fuel is going to come in the form of oxygen and glucose, and you're also going to see activation coming from the pathways firing correctly. And again, this is like tuning into a static radio station. If you're not getting a good signal, you're not going to understand what's happening. So the main areas of activation come from the spinal joints and the muscle spindle cells that lay in the bellies of your muscles. Your posterior mechanical facet joints, which are the joints that we adjust in chiropractic, are surrounded by little receptors called mechanoreceptors and proprioceptors, and these are known as tonic receptors. And all a tonic receptor is it detects changes in pressure. And your spinal joints are constantly stimulating your nervous system and your brain due to the presence of gravity. And your muscle spindle cells do the exact same thing, because they are also tonic receptors. So if these receptors around your spinal joints lose the ability to fire back to the brain correctly, your brain's function is going to decline. And we don't want that happening. So again, this is like tuning into that static radio station and not being able to understand what's being said. Or you're on the cell phone and someone's signal's breaking up and you can't understand what they're saying. We all know how annoying that is. Just imagine what it does to your nervous system. So your brain can detect 1 micrometer of change in the ability of that joint to fire back to the brain to keep it fed. And the micrometer is 10 to the minus 6th of a meter. So again, your nervous system has dedicated a lot of effort to detecting the information that's being stimulated or being sent back to the brain. So let's look at it this way. Let's say you go to an orthopedics office and say, "I want to do an experiment. I want you to put a cast on my ankle joint. I don't have a fracture, I just want to do an experiment." So they put a hard cast over your ankle joint. You wouldn't really necessarily have any pain associated with it, other than it would be a pain in the rear end to do your daily activities. Showering, driving, walking, all those things would be very cumbersome. At the end of the 8 weeks, if they go back and have you remove that cast, you would see a huge difference between right and left side. kind of giving you an example. This is just one person probably had a surgery or some type of injury that they had to be immobilized. So again, you can see what happens. The muscles atrophy on that side. We also see how normal the other side looks. And that's because this, when it becomes immobilized, is not sending information back to the nervous system. So kind of the way the nervous system works, if you don't use it, you lose it. As important as the ankle joint is to your brain, your spinal joints, again, are far more important because, again, they detect 1 micrometer of change in that ability of that joint to fire back to the brain. So your spinal joints develop dysfunction from a lack of motion at the joint. So this fixation, or what we call a subluxation, and for those of you in the medical field, this isn't the medical term for subluxation. It's not anything less than a frank dislocation. This is actually what we call a fixation. And it creates this interference in the nervous system, like a roadblock, or again, like tuning into a static radio station. The causes of fixation or subluxation include many different things, but the big ones we see are stress, you see toxins, you can have trauma, you can have negative emotions, nutrient depletion, poor diet, all these things tie in together. So many other things that are associated with it, but again, these are the big ones that create this interference. If we look at it from a segmental level, you can see how the nervous system controls things. If you look at C7, that's going to go down to your thyroid gland. It's going to be the bursa in the shoulders into your elbows. So again, if we want to make sure C7 is moving correctly, so the nerve supply going through to those end organs is going to receive that information correctly. If we look at T3, it goes to your lungs, your bronchial tubes, your pleura, your chest, your breast. All these things we want to make sure are functioning correctly at that segmental level so that the end organ gets the information that's supposed to from the brain. And if again we look at the lumbar spine, L3 goes to your sex organs, your uterus. We also see it to the bladder and to the knee. So again, this is how we look at the nervous system. We want to get those areas firing correctly so the end organ gets the information it's supposed to. So how do you know if you have subluxation? First thing that we see it usually is present in postural changes. Big one that we see is head forward posture. We could see pelvic unleveling or pelvic tilt. We can see head rotation. We see shoulder deviation, maybe one shoulder higher than the other. All of these things tell us you have subluxation. Second thing that we see is we motion palpate and actually static palpate through the spine. And a lot of times we can detect it. We've been trained on how to do this. We see a loss of what we call a springy infill. And I know that seems really weird, but if you can kind of imagine how something should bounce back and have a little bit of a spring to it, that's how your joints should be when we motion them. And if they are losing that springy infill and it's more restricted, then we know that's a segment that's not moving correctly and needs to get released so that it can send more information back to your brain. And this does not have to be painful or does not have to be tender. Another thing that we pick up subluxation on is going to be your neurologic exam. So again, we're looking at any interference that's happening in the nervous system. We could find through your deep tendon reflexes, we can find through your eye saccades, your eye pursuits, vibration, sensation. There's multiple things that we do from a neurologic standpoint to see where is there interference. The other thing that we look at is muscle testing. Again, looking at muscles or nerves fire into muscles to facilitate their strength and their balance. So if you're not moving correctly, if our muscle is not as strong as it should be, right versus left, then we know there's something interfering with the nervous system. So how do we remove this subluxation? The chiropractic adjustment removes subluxation and increases frequency of firing back to the brain. The chiropractic adjustment can be performed multiple different ways, and we do it multiple different ways in my office. You can do it manually. For those that don't like a manual adjustment, we can go to instrument, or you can even use table assisted as well. And we adjust people differently. I mean, obviously we adjust children and newborns completely different than we adjust adults. So it's not a one size fits all for how we treat the person. We definitely find that with adjusting as well. The chiropractic adjustment releases the fixation at the facet joint, causing this increase in stimulation back to your brain. So once the stimulation increases, guess what happens? Function also goes up. So let's look at the effects from the chiropractic adjustment when you start getting an increase in function. You're going to also see an improved immune function. And there's a lot of chiropractors, or some chiropractors, that are kind of crossing over, and some of them have PhDs in immunology, and they're finding a connection to your nervous system to an increase in immune function. We see improved range of motion. We see less pain, because pain is cortical. We're affecting the nervous system. We're going to change pain. We see better digestion, better elimination. We see improved focus, and better sleep. Conditions that can be helped with chiropractic. Again, we don't treat the condition. We treat the person who has a condition. But a lot of times we see patients with autoimmunity, we see people with ear infections, children with ear infections do very well with chiropractic. Asthma does very well with chiropractic. Carpal tunnel syndrome, you can see fibromyalgia, joint pain, whether it's in your knee, your hip, your shoulder, your wrist, your ankle. We can see headaches and migraines also respond very well to chiropractic. ADD, ADHD, we see TMJ dysfunction, PMS, plantar fasciitis responds very well, irritable bowel syndrome, prostate dysfunction, sexual dysfunction, infertility. And if you want even more information, you can go to our website, seawellness.com, and click under blog, and we'll have more videos explaining the connection to these as well. Chiropractic is not a panacea for all disease, but disease does start from a lack of proper activation to the brain. So you'll never achieve optimal health if chiropractic is not included in that. Diet is vital to your health, but without proper nerve supply, you cannot assimilate the nutrition correctly. If you have an issue like use SIBO, for example, which is small intestinal bacterial overgrowth, you can get those critters out of there and kill every one of them and be done with it. But if you don't have proper nerve supply to the gut through vagal stimulation, you're going to have SIBO to come right back. So again, this is why it's so important that chiropractic is a part of your healthcare plan. Exercise is extremely important to your health, but if you're not moving correctly, you're destined to have an injury or you're going to have joint dysfunction. And how many people do we see are having knee replacements, hip replacements from a lack of proper motion? Chiropractic helps you to move better. Chiropractic incorporates not only the adjustment, but we look at diet, we look at exercise, we look at nutritional support to provide you with superior health care and not sickness care or disease care. Chiropractic is for everyone. We see newborns all the way to seniors, so newborns, children, adults, seniors, everybody can benefit from it. So if you're ready to improve your health and your family's health and to decrease your pain and improve your chronic condition, chiropractic is for you. So join me in becoming part of those who are enjoying a new level of health in chiropractic. I look forward to seeing you. Thank you.